Good evening and welcome to City Voices. I'm Alex McDonald. I write for Coming Up, and I've been covering the ARC AIDS Vigil in UN Plaza in San Francisco Civic Center. The AIDS epidemic reached the United States in 1979, but not until actor Rock Hudson died of AIDS in 1985 did the disease become a household word. In that 6-year interval, the disease doubled every 6 months. In 1979, 11 people in the United States died of AIDS. In 1 week of February of this year, AIDS killed 311 Americans. Awesome as these numbers are, they tend to minimize the full extent of the epidemic because they hide the vastly greater numbers of children, women, and men who are disabled and often dying from insidious forms of AIDS known as ARC. When the people with ARC are included in the official statistics, we will find a 10-fold increase has occurred at the stroke of a pen. Currently, 170,000 Americans suffer from ARC. The number is growing. In San Francisco, the number is put at 12,000 to 15,000. Last October, 2 men with ARC, frustrated and angered by years of illness and neglect, decided to appeal in an act of civil disobedience to the American people. They chained themselves to the doors of the federal building in UN Plaza. They expected to be arrested, but the government chose to ignore the protest on its doorsteps. Word of the protest spread. Other people joined the protest. The San Francisco Board of Supervisors endorsed the protest. Fag bashers attacked them with sticks and bottles. Sympathizers provided them with tents, food, bedding, and medical help. An enduring protest was born. Now approaching its 6th month, the ARC AIDS Vigil continues to nag at the conscience of America. Yet years before the protest began, a few health professionals tried to warn the country of the full extent of the epidemic. One of these is Pat Norman, coordinator of lesbian and gay services for the San Francisco Department of Public Health. We asked her why this head-in-the-sands attitude on the part of public health officials.
I believe that it's because they don't want to spend money treating and providing services for people with ARC, because it is larger and larger and larger than anybody wants to concede, that they are trying very hard not to expand the definition and the diagnoses of ARC.
The longer they wait, the harder that's going to become. We're talking at the present time of possibly 200,000 people with ARC. If the definitions aren't changed, suppose they change the definition now, they would have to go to the public and say, we were wrong. There are not 20,000 cases of AIDS, there are 200,000. If they admit that they were wrong about that, that's a huge mistake to make. They almost totally lose credibility on everything they've been saying, including things where they may be right.
I agree with you.
If they wait 2 more years, they're going to be talking about it's not 50,000, it's 500,000.
Alex,
it gets worse and worse the longer they wait.
The departments of health and human services on the federal level have never been known to be visionary. They've never even been known to be contemporary. So that that doesn't surprise me, and certainly it shouldn't surprise you, that they would not begin to think of that. We knew 4 years ago that the people who were going to be affected by this disease were not only gay men, but also needle users and women who were the sex partners of men who had this disease. We also knew that in the East Coast and other parts of the world that many of the people, in fact a high percentage of the people, were ethnic minorities. The Health and Human Services Department division on the federal level and in most other places in this United States did nothing to prepare any of those communities for this event, even though there were some of us who said clearly, distinctly, and very, very, very directly this needs to happen, because if it doesn't happen, we're going to have 2 million people by the year da-da, okay? That was all out there 3 and 4 years ago. And obviously people have not responded to those figures even now. So that it's very clear to me that there is no commitment on the part of the federal government, because quite frankly, who cares about people who are gay, people who are needle users, and people who the federal government up to this point has considered being a problem. So it certainly is another kind of a way to weed out those of us who are not seen as being particularly wonderful.
Desirable.
Desirable.
We found confirmation of Pat Norman's speculations from an official of the federal government. Hal Freeman, an 18-year veteran of the Department of Health and Human Services, recently resigned to protest what he saw as the refusal of his department to apply the law to people with ARC and AIDS. Mr. Freeman's superiors in Washington told him, "We do not want to lend an aura of dignity to people with AIDS."
That's true. There's a section of the definition of handicapped person that would cover anyone who was regarded as handicapped. So someone who is openly gay and discriminated against because they may be thought to be carrying the AIDS virus would be covered by this law. That's
even if they're not carrying it and have no symptoms.
That's right. But just if they're perceived as such. So if they were to receive discrimination on the job or be denied any services whatsoever, they're covered by this federal law.
What would a complaint result in if it were being followed through by your office? What kind of relief would a person get?
Well, the office conducts a thorough investigation, and if it's found that there is a violation, there could be termination of the federal funds going into the program.
I see.
It's a major sanction. Usually that's avoided through some kind of negotiation with the agency. Most programs need the federal funds badly enough that they're willing to negotiate a remedy. So this agency could actually, if it wished to, get very prompt relief for someone who is discriminated against.
Is this the first time an issue like this has come up with this office? Have they ever restricted application in this way before to any other group?
No, not at all.
There's no parallel, no precedent for it, whatever?
No, in fact there is just the opposite parallel. A couple of years ago, you may recall that there was an issue involving handicapped infants, babies born with severe deformities who may be allowed to die. It was not a widespread problem. That didn't happen very much, and yet the far right made an issue of that. And our office responded by setting up an 800 toll-free, 24-hour-a-day hotline to receive complaints. It developed regulations and procedures for handling complaints. We dispatched investigators into the field anywhere in the country within 24 hours to investigate a complaint. And here was a political response, I think, to an issue. And the same thing could be done now. There are people who are obviously dying of AIDS who are being discriminated against, and we could give them the same kind of service if the office wished to do so.
How do your fellow employees feel about what you've done, and how do they feel about the policy?
I think everyone in our office disagreed with the policy. I'm speaking now of the Region 9 San Francisco office here. There were 40 employees on my staff, and I'd say every one of them agreed with me. At least they expressed support and agreement with my position. I think everyone believed that the policy was politically motivated or motivated by homophobia, and supported me. A director in one meeting in Washington was heard to say, "We don't want to lend an aura of dignity to these AIDS cases." And that, to me, is simple homophobia.
The vigilers have little time for accusations. They have instead made what they call 4 moral appeals to the federal government. They want the government to devote just 1 hour of federal spending to the search for a cure for ARC AIDS. They also demand proper funding for medical care and support services, including Medicare and Social Security disability insurance. But 2 of their demands involve no cost to the government or taxpayer. They want the Food and Drug Administration to allow American physicians to prescribe medicines and treatments for ARC AIDS that are now available to their colleagues in other countries. And they want officials at all levels of government, from the president on down, to condemn publicly discrimination and exploitation of ARC AIDS. To date, only the first of their demands has met with any success. Congresswoman Barbara Boxer moved in the Budget Committee to increase funding for research to $398 million in the next fiscal year. Meanwhile, the protesters maintain their vigil and give each other what support they can. We talked to one of them, Wes North. Before coming here, Wes attempted suicide until his doctors gave him only weeks to live until his disease would kill him. That was 7 months ago. Since I've known you, you've not been suicidal.
No.
Why?
Well, one of the things is when this vigil started, October the 27th, there's so much love out here. There's so much support. We can love each other. People has hugged me, and where that's one of the things that we want to get across, because one of the best things for a person with AIDS is the love that we get, you know, because that's one of the better cures. This is what I say, not what my doctor says, but like I said, my doctor says I'm doing better out here. But, you know, if it wasn't love out here, I don't think I would be here, because there's a lot of love out here. And when I'm in my room, when I was in my hotel, I just looked at the four walls and I just thought about dying, because there wasn't nobody there I could talk to. There wasn't nobody I could talk about my problems. And out here there is.
One of your friends here, who died several weeks ago, told me that the AIDS diagnosis is a death sentence, and he refused to accept it. He refused to accept the diagnosis because of what it would do to him. Is that a common experience?
Yes, it is, you know, because it is more like less a death wish, but we just don't really want to accept that in the way we feel, you know. And I'm the same way.
So you'd like to see the FDA have one name,
right,
for the disease, for ARC and AIDS. Maybe a new name.
Well, new names.
A new name. When you started last October, did you think you would be here in the middle of March? It's been 5 months.
Well,
pretty close. 141 days, is it now?
Yes. We figured. Well, we was joking at the time. We didn't think we'd be here that long, and we was joking that we would be here for a whole year. Well, it looks like we're going to be here that whole year now.
It's no longer a joke?
No, it's not. It's not a joke at all, you know, because I just wish they'll do something, the FDA and the president.
The wheels turn slowly. Are you having any success?
Yes, we are. The city's backing us. They had a couple city hearings here. We had
San Francisco?
Yes. We had a hearing in L.A., a state hearing in L.A. That went real well. And so now the city's backing us 100% out here, you know.
The Molinari resolution calls for a redefinition of ARC so as to include people with ARC, make them eligible for disability. The city had 30 days to do that. It's been over 90 days now. How do you feel about that? How useful is that support if it's just on paper? Or is it just on paper?
Well, I don't know for sure, but, you know, I wish, I don't think they're pushing it hard enough. I wish they'll just push it a little bit harder.
Although Wes officially has AIDS, he spent more than 2 years with an ARC diagnosis. To him, it's all the same. But to Pat Norman, the distinction represents an enormous wrong.
I'm really glad that you all are looking at ARC, the AIDS-related complex that is a devastating experience for those people who contract ARC, that in fact can lead to people being diagnosed with AIDS. My understanding that at this point that approximately 27% to 30% of those people who are diagnosed with ARC within 3 to 4 years come down with AIDS. The problems that we see with ARC is that it's not identified as a syndrome that needs to have the same support services as people with AIDS. That's wrong. ARC runs the full gamut, from those people who are asymptomatic to those people who are totally disabled.
If Pat Norman is an exception among public health officials, She also lives and works in an exceptional city governed by exceptional politicians. Last December, the San Francisco Board of Supervisors unanimously passed a resolution moved by Board President John Molinari ordering the Department of Public Health to act on redefining ARC. Supervisor Molinari explains.
People with ARC are kind of the forgotten people in the whole discussion about AIDS. Most of the concentration, both in the public press and legislatively and medically, has been with AIDS. I happen to believe that ARC is as serious, if not more serious in some ways.
Why more serious?
Well, the estimates of our own health department are that the number of ARC patients may be 4 to 10 times that of AIDS patients. And we are dealing with a large potential of patients that are going to have to receive services. I was in Washington just 2 weeks ago lobbying with the Congress and with the administration to stop cutbacks in AIDS funding and to in fact increase it.
How did that go?
It went very well. I led a delegation of local elected officials from around the country. We had a councilman from Boston, a councilman from Minneapolis, a councilman from Los Angeles, a councilwoman from Dallas, as well as other local elected officials who met with members of Congress. And in meeting with members of Congress on both houses and on both sides of the aisle, I was impressed with the level of understanding and knowledge about what was needed. And they seemed to have a handle on the fact that we should not have any cutbacks, as the Reagan administration has suggested, but in fact the funding should be increased substantially. Congresswoman Barbara Boxer has introduced a funding level of $398 million for the next fiscal year, which is about $150 million more than we have in this fiscal year. So there is a level of understanding among key members of both the House and the Senate, and particularly in those key congressional subcommittees where a lot of the funding is decided in some obscure way, and you don't see them most of the time. So I was very pleased. But meeting with the administration, let me tell you, that was a whole different can of worms. The administration seemed to have not only a lack of understanding, but a lack of caring, and that disturbed me very, very much. But going back to ARC, in my resolution, if you'll recall, I asked for a definition. Right. So that we could deal with that and that these individuals would be eligible for benefits. The health department, unfortunately, and I'm very angry about that, took a little far longer than I anticipated in getting back to me, and they still haven't completely come up with a definition. They want to have a definition, they tell me in a recent letter, that coincides with the definition that is currently being developed by the Federal Centers for Disease Control. That is so that individuals would become eligible for federal benefits of Medi-Cal and SSI. And I suppose that, in fact, is a good approach. It's just taking longer than I had anticipated. We have people who need benefits who get bounced around from one social services agency to another and are not getting any help. And you, as well as I, have visited the people at the Vigil and others who are making a good point and are also badly in need of help. And hopefully, they now tell me that by the end of this month, that definition will be crafted. I'll see it. I'll believe it when I see it.
The Vigil has been more than a nagging presence on the doorsteps of a remote regional office of the federal bureaucracy. In February, a delegation of Vigilers took their appeal to Washington and lobbied Congress. They came back discouraged.
They shook my hand and said I was sorry when I got done talking to them. You know, of all the words, you didn't have to say I'm sorry. Something else could have popped up or something.
Takes away all hope.
Yeah, well, when here these guys are, you have the panel of 6 people in front of you. These are the guys that distribute the money that is going for our research. These are the guys that know everything that every researcher is doing on this thing. And when they shake your hand, they say, I'm sorry. And you've just went over about a half an hour to a 45-minute meeting. and nothing came out of it. It really is discouraging.
But you're still hanging in.
Yeah. Well, you have to hang in, because if you give up, there's no hope.
In May, I was back in Washington, and I led a delegation of people with AIDS and
That's
ARC.
May of 1985.
1985, prior to the Candlelight Memorial Vigil. And at that point in time, we were running into the same problems that you were. So it's not like you just went back and it was like the first time people with AIDS were there or people with ARC were there. These issues have been raised since 1983 that I'm aware of, when they held the first hearings on AIDS with regards to the federal response to AIDS. And it's continually the same issues that are being raised. The funding, the services. I don't think we can negate some of the processes that have come out, like presumptive disability for people with AIDS, but presumptive disability does not exist for people with ARC. We keep calling for a redefinition of AIDS. And when CDC set up their guidelines for AIDS, it's only for the medical community. It was never intended to be used as guidelines for Social Security Administration. The big issue is the definition around AIDS. AIDS is one of the only diseases that I know that you have to have another disease before you get a diagnosis.
Well,
one has to have a cancer or an opportunistic infection. Originally there were 3, I believe, and now it's broadened to, I think, 13 opportunistic infections. Without that, one does not get an AIDS diagnosis. You can have antibody presence, you can have antigen presence, but if you don't have an opportunistic infection or cancer, you don't get an AIDS diagnosis. What I think has happened, and I've raised this issue with them, is I think that the government is afraid to redefine AIDS at this point, because what's going to happen is the sheer numbers are just going to, they're just going to tenfold. And all of a sudden, America's going to see that we don't have 17,000 cases, we have 170,000 cases. And the government's not ready to accept that responsibility.
The vigil, it should be clear by now, is more than a protest, though that is how it started out. For Wes, it is a source of love. For Jean and Evan, a focus for their energies and a reason for living. For Richard, a welcome and overdue ally. For many others, it represents a new flowering within the gay community, a creative response to an appalling challenge. Pat Norman again.
Our springtime is coming. I think that people are learning all kinds of skills that they would never have learned before. How to love each other, how to support each other, how to be there for each other. That's really incredible, and a whole different level of interrelating